Hey y'all, welcome back. In this video we're going to be going over our crash cart. So I'm going to kind of give you a breakdown of what supplies are in your crash cart, some things to note of what's not in your crash cart, which is also very important. So we're going to go ahead and get started. On the outside of your crash cart, you're going to have a couple of things. You're going to have a sharps container. So always make sure when you're in a code, if you're at the crash cart, definitely make sure you're putting all your sharps in the sharps containers, just so that way there's not any loose needles hanging around or anything like that. Under that, you're going to have a glove box, and honestly I think they usually stock like a medium, but they'll stock some kind of gloves, so that way if you need gloves then you have a pair there. You're gonna have an oxygen tank. Part of our daily routine with our crash carts is that we're checking that your oxygen tank is not empty, which in this case this one is, because this is for education purposes only. You're gonna have the front of the cart where all the drawers are labeled as to what's in there. On the top of the cart, this kind of varies unit to unit, but things that are definitely going to be on there are, number one is your life pack, your defibrillator, and there is actually a video that we have on the channel about the defibrillator and how to use it, so I'll go ahead and leave that in the description box below if you'd like to view that. But in the ICU on our crash cart, on the top we'll keep our defibrillator, we'll keep our electronic razor, so if you needed to cut their hair then you could. We'll also keep end-tidal CO2 on there, and we'll keep a Doppler on top as well. So usually your resuscitation binder here is going to be actually on the side pocket. That's where we usually keep it. Your resuscitation binder, when you open it up, it's going to have a few things. Usually right here it's going to have when your expiration date is for your cart. Once you use the cart, you'll actually fill out the sheet that's here, and you will return the cart locked to Central Supply and they'll restock it. Also in your cart you're going to have some resources here. Some important things that I like to go to is the crash cart medications. So in here it's going to have basically like the drug, what it's indicated for, the dosage, and precautions. And they have a bunch of those medications here. And then if we continue going, you're going to have, stickers for your code. I don't believe we really use these that much, but everybody does have a role in the code. In addition, they're going to have a little how-to of your rapid response and your code sheet. So, if you're documenting and you don't know how to document, which hopefully you do if you're documenting, because this is one of the most important roles. But basically, this kind of breaks down what your entire sheet should look like. Next, in this red pocket, we're going to have the code sheets. So I'll get that. Then we have our rapid response sheets. After that, we're going to have our rapid response standing orders. So in the standing orders, this is basically like what you could do at a rapid. So one of the things, for example, that's on here is if your patient's hypotensive in a rapid response, you can give a 500 ml bolus if their systolic's less than 80. Next to that, you're going to have your sepsis alert sheets, and then you're going to have a debriefing tool, and then in the back you're going to have your algorithm for all of your ACLS algorithms here. In addition, you'll have your sepsis algorithm, you're going to have your heart alert algorithm, your stroke algorithm, all that stuff is in there. So that is a rundown of your resuscitation binder. So continuing on the side here, this is not in there. On the side here, you're going to have some tubing, you're going to have electrodes, you're going to have some alcohol wipes, you're also going to have your pads. So there's one set on the outside of the crash cart, and there's another set in the top drawer. So that is there. So if your leads, your SpO2 finger probe, all of that stuff is going to be on the outside of your crash cart if you need it. Down in ICU, we keep an airway box on the crash cart, but note that the airway box is the exact same stuff that's in the top drawer of your crash cart. So if you're in a code situation, you should be using the top drawer, not the airway box, but that's just where we keep it in the ICU. The other airway box is going to be in the medication room. One of the last things that is on your crash cart in addition is going to be your ambu bag. In the bag, you're going to have your ambu bag. You're going to have a CO2 detector. You're going to have an extra face mask. You're going to have a wall oxygen connector. You're also going to have a PEEP valve. So for ICU patients, it's important that if they're on a ventilator prior and they code and they were getting PEEP, that you put a PEEP valve on. The PEEP valve will allow us to give the patient PEEP when we're bagging them, because when we take them off the vent, obviously there's not any PEEP unless you have your valve here. Continuing on the back, you're going to have your backboard. You're going to have your power strip. So whenever you disconnect from the wall, you should make sure that you disconnect your power cord here. Everything else should be plugged in to your power strip. But if not, then just make sure you unplug everything, because when you run with this cart, you don't want the outlet to come out or something to fall or anything like that. The other thing that's here on the side, this is called a bougie. So this is a introducer that we can use when we're intubating if it's a difficult airway. That's here on the side. In addition, if we're having a difficult intubation, the emergency department should be bringing the GlideScope to the code. So now let's kind of go drawer by drawer. In the top drawer, it's going to be your airway. So when we open this up, I apologize, has been looked through, but everything is in the general place where it would be. When you open up your crash cart, there's going to be plastic coverings over each box. So when you open that box, basically that tells Central Supply when they're restocking that you accessed it. So don't access something if you're not using it. You're going to have your ET tubes here on the side. So it's going to say the size of your tube there. So you have your various sizes. In addition, you're going to have your oral airways. You're going to be of various sizes here. In addition, you're going to have your blades for your laryngoscope. You're going to have your stylets. You're going to have CO2 detectors, more suction. Here we have more blades and your handle. Remember, if you have seen our airway box video, you know that when we intubate, we need a handle, we need a blade, we need a stylet, and we need a tube. So that is what's in that box. And again, this box pretty much is identical to what will be in your airway box down at the bottom. Here, you're going to have some extra pads. On this box here, this is going to be some important things that I like to point out for my ICU nurses. This is going to be where your pressure bag is. This is also going to be where your pressure line tubing is for like an A-line. You're going to have your quick trach. You're going to have your suction catheter kit. You're going to have a 100% non-rebreather, a 50% veni mask. You're going to have in here some face masks. You're going to have samples for your A-line. So I'm just putting everything back now in here. So that is what's in your top drawer. It's everything airway. So if you need anything airway, you're going to go to your top drawer. In addition, if you needed a pressure bag or if you need your pressure line tubing, that's going to be in the top drawer. Something to note for airway that is not in our carts is actually this here, which this is an LMA. So this is when you are intubating their larynx. So essentially this is not going into their trachea, rather this is going into their larynx. So these we actually keep in the ICU in the medication rooms. So if you need your LMA, that's going to be where you would go. This is what an LMA looks like, but we don't keep it in our crash cart. Typically when we intubate, we're going to put in an ET tube, but you know, if you have a difficult airway for some reason you can't intubate, then an LMA is also a possibility. But we would definitely go for a GlideScope or a bougie and try to intubate them before we would go for an LMA. IV supplies is your next drawer. So this is going to be where you have your IV start kits, your IV tubing. You're going to have your 3 ml, 10 ml syringes. You're going to have for your peripherals, you're going to have all your lab tubes, your tape. Something else that's in here that I did not know until recently is your angiocaths are in here as well. So angiocaths, you would think, you know, you need a 16 gauge, cool. But in addition to that, if you have a tension pneumo, this could be used to decompress that. So that is that drawer. The next drawer, this is your medications drawer. So medications that are in here are going to be your major ACLS drugs. So your atropine, your calcium, your epi, your bicarb, your adenosine. You're going to have your Narcan here. In addition, at the vials at the bottom, you're going to have your amiodarone, you're going to have your Levophed, you're going to have a bigger vial of epi. So if you ever run out of your epi cartridges, then you can always go to your giant epi here. This is supposed to be used for when we mix epi drips, which if you didn't know how to mix an epi drip, you could go to your resuscitation resource binder. But the tip that I remember is just that epi is just like your single strength levo. It's 4 and 250. So you would put 4 milligrams of epinephrine in 250 of NS or D5. Typically in a code we would go for D5W, since hypoglycemia is definitely something that we would probably be combating. In addition, you'll have in here metoprolol. It really depends on your hospital. If you're watching this and you're not from our hospital, this is very hospital dependent, but a majority of time all of your ACLS drugs will be here. At our hospital, we have this medication drawer, but also pharmacy will come to every code with a orange box that has backups of all these medications. In addition, they'll have some other meds. So definitely, if you're looking for a medication in the code, check this drawer. But then if it's not in this drawer, check the box. And then if it's not there, then you would go for your Pyxis. Okay, so just to kind of go over each of these cartridges, you're gonna actually open from the bottom. So you're gonna see your kind of perforations here that you would open it from. So when you open it from the bottom, you're gonna get two kind of things. You're gonna have your drug in a vial here, which this is saline, just so you know, and then you're gonna have your other cartridge here. So what you're gonna do is you're gonna take off your purple and take off your yellow, and you're gonna screw in your vial up at the top, and then actually on this end here, this is gonna be where your Luralock is. So you can connect this directly to your IV site, and then all you're gonna do is push your vial in, and then your drug will go up into your IV site. So let me connect that real quick so I could show you a little bit better. So all I did was I just took off the yellow at the top, took off the purple at the end of the vial, and then I just screwed this on, and then I would basically take off the top yellow here, and then all I can do is just, you know, get all my air out, and then I could screw this onto my IV site, and then I would go ahead and push the drug. So that is how you would use these cartridges. If you've never used them before, they're honestly not too difficult, but they can be a little, you know, like what are these things whenever you're opening them up. But they're easy because everything is already drawn up. The doses are what they should be. This does vary with PD codes, just because when you are unfortunately, you know, having to resuscitate, you know, a child when they've passed, and you're resuscitating them, it does depend on their weight. That's a PALS thing, which I only work with adults, so I wouldn't know too much about, but that will vary. But if you're in an adult hospital, then this is going to be pretty much, the doses are always the same. So that's that. In the next drawer, you're going to have your IV solutions. So you're going to have, which usually in your medications drawer, you're going to have a sheet that says what's in this drawer. So you can always reference that sheet to see like, oh, that's not in there. I need to get it from the orange box, or maybe I need to get it from the Pyxis. It's going to look similar to this. So this should give you a layout of what's in here. So you have your D5 100 mLs, you have 2 bags of that, and then you have a 250 bag. You're going to have your dopamine, your lidocaine. You're going to have, you should have magnesium in here, but I've run into situations where it's not in there, but it's in the orange box. So just to know. You're going to have three bags of 250 NS. You're going to have 2 bags of 500 NS, a liter bag of NS, and then you're going to have a bunch of flushes. So that's going to be in here. And you would use this for IV boluses and also mixing drips. Remember, if you're mixing drips, to label the bags so that way you know what you're infusing and how much is in there. And then always after the code, if they survive and they go to ICU, you want to make sure to switch out those bags as soon as possible. In addition, if you're mixing drips, you always want to get a second verifier. The next drawer is going to be our central line. So in here, you're going to have a few things. This has definitely been dug through already, so it's kind of unorganized. But basically, you're going to have 2 kits in here. One's going to be a multi-lumen central line, a triple lumen, and it's always going to be a 20. In addition to that, you're going to have a Cordis in here. So this is that kit. And you can tell which one is which because of the picture in the top left corner. So that's your triple lumen and that's your Cordis. In addition to that, you're gonna have your Cordis kits here. You're gonna have your gauze, you're gonna have your iodine, you're gonna have your 3-way stopcocks here. So if you're giving adenosine, that's gonna be very useful for that. In addition, you're gonna have all of your Aero A-line kits. So something to note about your Aero A-line kits is you can put in A-line in the radial artery, femoral artery, or brachial artery. If you don't know which kit to get, all you got to do is read the label. This one says it's a radial, this one says it's just arterial. So this one is a femoral, and this other one is a radial A-line. And you can also tell because the catheter is shorter on this one than this one. This one's a lot longer. So that one's going to be, the longer one is the femoral one. So let's continue on. More 3-way stopcocks. There's your sutures in here. Sorry if this is ticking you off or getting you upset on how unorganized this is, but this is the education one. That's why it's all torn through. So yes, but basically what you need to place a central line is in here besides the ultrasound machine and the ultrasound probe. So to note of that, basically when you place a central line during a code, a majority of the time it's not going to be perfect. It's not going to be as sterile as it possibly could be. So if you're placing lines and they're not sterile, anticipate that you're going to need to switch those lines out. Again, remember the central lines, so we may not have ultrasound, so a majority of the time we're going to go for femoral just because the patient's going to be at less risk of complications like pneumothorax whenever you're there. Also, it's very difficult to place central lines in the subclavian or the IJ during a code situation, so you're going to go for their fem. Usually. The last drawer is going to be your miscellaneous supplies. So in here you're going to have your sterile gowns, you're going to have your sterile gloves of various sizes, you're going to have some isolation gowns, you're going to have your suction tubing, you're going to have stuff for an NG tube, a manual blood pressure cuff, restraints, which something to note is if your patient is about to code, we want to make sure that we remove their restraints. So basically, if people are restrained and they code, this is going to be an automatic reporting to your hospital, but also the medical examiner, because if patients are dying in restraints, that is not a good thing, especially, you know, in situations where maybe the patient's on BiPAP and they aspirate and vomit and that's why they code. A patient, the only way to take that mask off is their restraints, is their, you know, them being able to do it themselves. And so, you know, that's why some people, if they're on continuous BiPAP, they don't put their patient on restraints. Others, they're okay with it. But, you know, that just varies person to person. But that being said, is if your patient is, you know, at risk for coding and they're not at risk for self-extubation, then, you know, don't restrain them if they don't have to be restrained. In addition, down here, this is going to be your sterile barrier. You're going to have your suction setup, and then remember your oxygen setup is in the bag up top. So that is your crash cart. That is everything that's notably in there. There are some things that are not in your crash cart, and these kind of include, remember the magnesium is what I told you about. In addition is the cord for your A-line. So if you get an A-line in during the code, the cord is not going to be there, but in addition, you need to think about where are you in the hospital, because not every hospital has a monitor that you can connect the A-line to with the cord. So some units are unmonitored, or not monitored. So you just want to take that into consideration. So like at our hospital, our ICU, PCU, and tele, they all have monitors. In addition to that, the PACU, pre-op, ER, they all have bedside monitors, but on transplant and on the medical and surgical floor, they do not have the monitors, in addition to the psych units. Another thing to note, that what's not in your crash cart for us is chest tube kits. So if you're on a floor and you need a chest tube kit, that's not going to be in there. Drugs for rapid sequence intubation are not in our crash carts, but we do bring the rapid intubation box to codes, in addition to the box from pharmacy that has backups. Another thing that is not in your crash cart is going to be, if your patient passes and you need a bag for the body, that stuff is not going to be in there. So just make note of what's in there and what's not in there. A majority though of what you need is going to be in your crash cart. So if you do come and look at the crash cart, just remember there is a little scavenger hunt that's on here. So everything that you would, this is just a few things of what you would need to find if you want to practice looking at your scavenger hunt. But yes, that is pretty much it. So leave me in the comments if you want to know where something else is in here that maybe I didn't talk about. So that is the end of the video. Thank you so much for watching, and I'll see you in the next one. Bye.